one of the so kind of going down your website a little bit more, healthcare. I saw, and this is more just a. This question is not really mine, but more of a. I've seen it tossed around, and not just in terms of healthcare, but in all sort of industries in general about the for-profit nature of different things. And I often hear people say, "Well, how would you innovate then? Like the United States, yeah, we have to pay more for certain things, but we developed the COVID vaccines, and we have like people come here for the top end surgeries that maybe are new or cutting edge or that sort of thing." What is your sort of response to that claim or question, and what is your sort of plan to address getting healthcare to those who need it whilst continuing to be able to innovate?
Absolutely. Healthcare, it's something that I, on a very firsthand level, have dealt with. My dad has been a diabetic since he was about 11, 13 years old. And just kind of fast forward now, he's in his mid 50s, and he is in a hospital very frequently. And I've been told very directly that he wouldn't make it many times. In his 50s, he's reliant on having dialysis. He's had triple bypass surgery multiple times. And, I remember being here and, him being upstate at the hospital in New York. And, the doctor saying, look, we're not able, it's too much of a risk, to open things up, or try to open things up, um, only a small fraction of his heart is functioning properly. And my dad's been dropped from health insurance. It's been hard to get things like life insurance because of something that he had no control over. And I remember his just fear a couple of times that, little princess, I can't go to the hospital, to the doctors, because I don't have health insurance. We're kind of in that limbo fighting with, the insurance company. And my dad is very medically fragile, very medically fragile. And so essentially what we say is that for the haves, you deserve to live. You deserve to get the top quality, healthcare services. And for those who can't afford it, that your life isn't worth it, And again, with us, we put humanity and equity at the center of all of our policy stances. And we believe that access to health insurance is a human right, not a privilege. Certain things, and I believe I said it to you, health insurance, healthy foods, housing. That's at the bottom of Bloom's taxonomy. So as governor, it's not, we don't just say affordable healthcare. We need to ensure healthcare for all. And I understand that it's easier said than done. But what I do know is that we're able to do what we put our minds to. We're able to do what it is that we want to do. I've seen countless times we just happen to find money from out of nowhere. For example, in Richmond over the summer, and I hope I'm not quoting the amount, but it was between $3 to $6 million that the mayor said he stumbled upon in surplus. You don't just stumble upon that amount of money because it was never lost in the first place, right? So where there is a true will, there is a way. And when we have legislators, not to just include the governor, but when we have legislators that put humanity over profit, then anything is possible. Just the cost of insulin alone, like we have community members that cannot afford the insulin. Again, when we make it so that that access to certain vital, medications and healthcare services are dependent on your ability to pay, then we're putting profit over humanity. We're putting profit over people. And so as governor, we will comb through our budgets and we will do everything in our power to ensure that all Virginians are, have healthcare insurance. Because again, that is at the very bottom of Bloom's taxonomy in order for us all to be able to survive. And again, the pharmaceutical business, the healthcare, it is a big money making business, that is at the expense of so many lives that just can't afford it. And it does not mean that their lives, that our lives, because I fall in that category as well. It does not mean that I should not have the right to have access to the ability to live, that I should not be able to get dialysis, that I should not be able to, get the best healthcare possible to help with a given illness. And so that's something that's really important to myself, to our campaign, to the Liberation Party, is ensuring that things such as healthcare, ensuring things such as housing, healthy access to healthy foods, right? Because that's a preventative measure. In many cases, if we can help people to have access to healthy foods, then that's a preventative measure. And something that we believe very heavily on is in taking proactive approaches. Some things we can be very proactive, about, such as healthcare, or excuse me, such as different illnesses. In some cases, if we can ensure that people have access to some healthy foods, then it can help reduce the dependence or need to seek certain health care.
Yeah, no, I totally agree. I think for me, it's a struggle to find the balance between the innovation and the top end stuff, like you were saying, whilst also making sure that everybody else is not sort of left in the dust. Because I think, it, and I think you would agree with this as well, but the innovation and the kind of the money that people put in as an investment does bring, I would say, some positives in terms of like the COVID vaccines and some of the other stuff. And so for me, it's just kind of a how do you balance that? So have you given any thought to kind of that sort of balance, or where are you with that in terms of a um like a not necessarily policy, but how do you allow for that to continue while bringing along everybody else?
Right. So, again, unfortunately, we live in a world, we live in a society uh, that is very money hungry, right? So, as a teacher, I was just teaching my students, we learned about, water quality and watersheds. And I had showed them this video, and we had talked about, Flint, Michigan, and the lead in the water. And, they said, but isn't the government like supposed to protect people from stuff like this, right? So it's like there's certain things that our government has the ability to address and to prevent. But again, we have to look at the people who are being most directly or adversely impacted. We look at, in Flint, it was the Black communities, mostly Black communities, that caused mothers who were pregnant to have babies with birth defects. We hear about in some of our, and I know this isn't here in Virginia nor the United States, but when we talk about, the cost, of some of the innovations, as we were watching the video, we were talking about water quality, and I believe it was in Mexico. And there was a mother who was talking about how she lost some of her babies simply due to diarrhea and not being able to afford an antibiotic. They are very inexpensive, right? The raw value of some of the medications are very inexpensive. So we must look at how much profit is being made, for some of these medical services and for some of the medications.
So would you say maybe like a price cap, or would you do some sort of maybe an audit and to see kind of what percentage of profits they're making, or maybe you would say something along the lines of, and I'm just throwing things out here, I have no idea whether or
Mhm.
not these would actually work, but maybe some sort of, okay, we will throw you a tax break if you cap the price at whatever.
Right.
Are you looking at sort of things along those lines? Is
Right.
that kind of where you're at?
Yeah, I think that we definitely need to put some caps, in place. We absolutely do need to put some caps in place. But I am a very strong believer, and I know I said this earlier. Um, as governor, it will not be a princess decision. I believe in bringing people to the table. Let's bring in stakeholders to the table. Let's bring in people who are impacted, by the very very high cost of of some of our medical services and medications to the table. Right before I got on this call, I was on the stakeholders call for for the Marcus Alert bill, and I was giving them feedback, and some of my questions they kind of ignored. But again, we can't keep pushing legislation forward about people who are impacted without making sure that we're elevating and including their feedback and their concerns. So that's important, because when we talk about equity, and I think you and I talked about this a little bit, what someone was, and when we look at equity and equality, someone may say, okay, well, we want to make sure that we provide equal housing opportunities for everyone. That's the thing, isn't it? Right. Well, what's considered equal, or what somebody may say is equal, may not be for the, one person, to another. And that's why taking an equity lens, even if we're looking at sliding scales, right? So we can't put everyone in one category and say, okay, we've decreased the pricing for, the cost of living, or a housing unit, or a rental property. So now this should be equitable to everyone, because it's not going to be. And it goes back to what I said about education. We have to get rid of that one size fit all, system. And I believe that is true as well when we start looking at healthcare, when we start looking at, access to, medications, going back to insulin. If we say that we drop the price to $10, and I'm just making this up very hypothetically, for access, for insulin. Well, maybe to you that's, something that you can afford. But to me, if I'm struggling just to stay employed, then that's not something that I can afford. So therefore, I will not have access to it. So again, I think that things that are heavily connected to our right to exist and survive, we really need to zoom in closer and look at how we have been doing things, and to make sure that we are ensuring equity so that everyone has the access to those things. And I do feel that education is a part of that, because if we do not ensure an equitable, high quality education for all, and not just some, not just those that are private school, then it becomes a negative snowball effect, right? Then you're going to have a hard time getting employment. If we have the ability to get some of our students licensed to be a CNA before they even graduate high school, right? So we're putting them in a position where they can come out of high school making money, compared to a school that does not have such programs. And so we have a student who is coming out struggling to get employment, or they're making minimum wage, somewhere else. So again, are we ensuring that all of our schools, have those, excuse me, honey, I need you to move. Are we ensuring that all of our schools have those trade programs so that our students can all have the same opportunity, or is it only our highly funded schools? And the same thing again is true with medications and access to healthcare.